We have more tonight on a disturbing assault of an elderly patient at Cowichan District Hospital last month. The senior had been sharing her room with 3 men for nearly 2 weeks. As Kristen Robinson reports, the Nurses Union says it has raised concerns about men and women sharing hospital rooms for years, but nothing has changed until now.
When an 83-year-old dementia patient was admitted to Cowichan District Hospital in early December after a fall, she was placed in a 4-bedroom with another woman and 2 men. When the other female patient was moved, she spent several days sharing the room with 3 men. When one of the men was moved, a 48-year-old man with alcohol abuse issues was placed in her room. 3 days later, he allegedly sexually assaulted the elderly woman.
This is an extreme example, the worst case scenario, and really heartbreaking. And the nurses that were involved were heartbroken.
Health officials say the hospital was busy at the time, and nurses say it often runs at overcapacity. A full review is underway to determine why an elderly dementia patient was sharing a room with 3 men in the first place.
What ended up happening is absolutely horrific, but it's something that nurses have been concerned about for probably the last 6 or 7 years when cohorting actually started. It started largely with the overcapacity protocols, which were supposed to be a temporary measure.
The health authority has now formalized a policy to minimize mixed-gender rooms.
Immediately after this, in less than 12 hours, there were new guidelines drafted.
When men and women must share rooms, a 2-woman minimum will now be enforced. All patients must be mentally alert and able to talk, and those with a history of violence, mental health, or active substance abuse issues will not be placed in mixed-gender rooms.
Patients now are being moved all over the hospital to now create male and female rooms only.
The Cowichan facility will turn 45 years old this year, and with an aging population, staff would really like to see funding for a new hospital. Meantime, only 8 of 80 medical surgical beds are in private rooms like these ones, where nurses say dementia patients must now be placed.
We're running at overcapacity number 5. 5 is supposed to be a crisis. When you're in a crisis mode on a chronic basis, it's very difficult to mix patients appropriately.
As nurses work to keep patients safe here, the 48-year-old Duncan man accused of attacking the senior with dementia will appear in court February 14th on sexual assault charges.